everyone. My name is Maria Fernanda Gavazzoni. I'm professor of dermatology. I work at the Fluminense Federal University in Rio de Janeiro, and I'm here at the World Congress of Dermatology in Singapore to talk about hair. So my first presentation in this great congress was about hair loss in women. The hormones, they do all the work. So we have pregnancy, we have menstrual, oral contraceptions, we have menopause, we have polycystic ovarian syndrome, and lots of things that all over our life we experience and may influence the hair cycle. When the women complain about, well, my hair is shedding, it's not only baldness. Sometimes it is connected to baldness, which is androgenetic alopecia, and sometimes it's just a telogen effluvium. When it's really severe, it usually takes longer than 6 months. It's called the chronic telogen effluvium. And this is when the patient comes to us to investigate and to treat this very complex condition. So what we do is first to differentiate whether this hair shed is only a telogen effluvium, or if the hair shed is also associated to another condition very common in women, which is called androgenetic alopecia. So one tool that we use a lot to differentiate both diseases is the trichoscopy, dermoscopy of the scalp. We use a dermatoscope. It can be digital or optical. So you define whether there are features in this test to recognize the condition of telogen effluvium or androgenetic alopecia. One of the most important features in dermoscopy of the scalp is called anisotrichia, which is different diameters of the hair fibers. Because in androgenetic alopecia, the part line here of the mid-scalp is wide. And you see that it's wide because hairs are getting thinner. So you have thin hairs and large hairs and thick hairs all mixed. But when you have only telogen effluvium, you just have the hair shed. So the hair shafts, they have the same diameter, but you lose 1 or 2 in each hair follicle ostia. So once you made your diagnosis, normally the treatment is a combination of oral minoxidil, topical minoxidil, oral finasteride or dutasteride, spironolactone, and sometimes what is controversial are the topical corticosteroids that can be used for 3 months tops, not more than 3 months. And the rest of the treatments you may combine, but be aware that finasteride and dutasteride cannot be used in fertile women. So except in this specific case, you cannot use dutasteride and finasteride in women. Another presentation in this congress is about cicatricial alopecia and the differential diagnosis. It's very, very difficult sometimes to make diagnoses and differentiate them because they all can overlap. Lichen planopilaris, frontal fibrosing alopecia in a pattern distribution, central centrifugal cicatricial alopecia, mostly in African women. And I also talked about neutrophil cicatricial alopecia, which are dissecting cellulitis, and the Calvin folliculitis. So the main tool to differentiate between them is trichoscopy. You can never do the proper diagnosis without trichoscopy. And sometimes you have to do a scalp biopsy. But this scalp biopsy must be guided by the previously test made with the dermoscopy. So what you have to look at when you do this test are the features of those different kinds of cicatricial alopecia. First of all the follicular ostia are gone. So it's kind of tip that there has been fibrosis in this scalp. And we can see erythema around the hair ostia. We can also see the scaling, which is called the perifollicular sign. And this is a sign that there is some inflammation in the root of this hair. And unfortunately, it's an inflammation that is going to lead to fibrosis. The hair is not capable of coming back. So we have to recognize those conditions and make the diagnosis as early as possible in order to treat them as early as possible. I think the most important of all of those types of cicatricial alopecia that I just mentioned is frontal fibrosing alopecia. Frontal fibrosing alopecia can affect men or women, but it's more common in women. This kind of alopecia has not been described before 1994. It was described by Dr. Caussade. And before that, we have never heard about that. So we suppose that this is a new kind of alopecia. We are making this diagnosis much more frequently now. We don't know if it's epidemic, what is happening, if there is some trigger. And this is interesting because the most important sign is a recess of the hair implantation, of the hairline. But it's not only here. Women lose eyebrows, men lose eyebrows and beard, and also the body hair. When the person asks for a consultation with a doctor, most of the time the problem is advanced. So what we educate the doctors to understand and recognize are the early stages of this disease in order to at least stop it, the progressing of the disease. You cannot treat it. You cannot make the hair come back, but you can stop the progress of the disease, which is very important to do and not easy. Talking about the hair field, what I think it's worth to improve the research in this area. I could say that it's about white hair, graying of the hair, but it's not the most important for me because we have hair dyes and that's it. But I think we should increase our research and focus our attention to try to regenerate the hair, to avoid the fibrosis. So when I talk about cicatricial alopecia, that means imagine for a woman, for men too, to lose all her hair, never to have it back. Of course, you can live without hair. You can buy a wig. You can move on your life. You're not going to die before you lose your hair. Emotionally speaking, it's very difficult for a woman to lose the hair. So I think that we should try to make more researches about the regeneration of hair. But I would like to call attention of all of you that all the researches should never be done with animals. We should follow the eco-friendly researches, and we can do that. We know that big enterprises are following this path of making research in vitro. And this is our future. This is what we have to do with compassion, with love for all of us, not only humans, but all of us.